As the nation's leading mental health advocacy organization, MHA covers a lot of ground. We are about all of prevention, early identification and intervention, health, education, and social services integration, and intervening before stage 4 is the key. And as it is with every condition, recovery should always be our goal, even when cures are not yet possible. But for too many people, what passes as early identification and intervention is the first time a child engages with the juvenile justice system. That engagement is pretty common for kids with serious mental health concerns that have usually already been untreated for years. And let's be honest, it is even more common for Black kids. We can do much better than that. And we are joined now by someone who's on the front lines of helping us figure out how. I want to welcome Ricky Watson, Executive Director of the Juvenile Justice Network. Ricky joined NJJN as its new Executive Director earlier this year on January 2nd. As an alum of the Youth Justice Leadership Institute, he's ready to help NJJN move into the next phase of development as an anti-racist organization and one that centers the voices of those most impacted by the injustices of the youth legal system. Ricky earned his JD from Elon University School of Law and his BA in political science from Wake Forest University. He began his professional career as an assistant public defender for the Guilford County Public Defender's Office in Greensboro, North Carolina, where he represented hundreds of indigent adults and juveniles charged with misdemeanors and felonies. Prior to joining NJJN, Ricky was the regional manager for the Vera Institute Center on Immigration Justice Unaccompanied Children program. And before that, he served as the co-director of NJJN's North Carolina member organization, the Youth Justice Project of the Southern Coalition for Social Justice, where he advocated for policy changes to disrupt the cradle to prison pipeline. Welcome, Ricky.
Thank you for having me. It's really nice to be here.
Great. Can you start by telling us a little more about NJJN, your mission and goals?
Yeah, absolutely. Our goals and our mission, is ultimately to reimagine what juvenile justice looks like. We're a membership-based organization of about 56 to 58 different members right now and actively growing. And justice looks different in every community. And ultimately what we do is serve as a national presence to connect all of these advocates across the country, to support and facilitate the work, and to create a space for, and particularly with the Youth Justice Leadership Institute, create a space where advocates can rely on one another and just build community. We're a large network, we're a mighty network, and we really believe in the work that we're all doing.
What are the key issues that are emerging these days, and have they changed in the course of this year?
Yeah, I mean, it would be hard to talk about any of the work that we're doing right now without discussing COVID-19. COVID has really brought to light a lot of the issues that many advocates have been talking about and discussing for years at this point. When we speak about the need to bring resources to communities, to bring opportunities to communities, and to remove, the presence of over-policing in communities, that's what this defund police is really referring to, right? Clearly, the needs of young people in this moment, in this country, and the cries and calls for racial justice, these are all things that, as an anti-racist organization like the National Juvenile Justice Network and all of our members have been screaming. And we're happy to see people finally joining in that are new allies and new advocates. And we're really looking forward to being able to capitalize on this moment. Obviously, a lot of situations have been really tragic. We lost the life of a young boy in a facility in Michigan just a few months ago, around the same time that George Floyd was murdered. He screamed out the same exact phrase of "I can't breathe" when he was held in a facility and restrained by some staff members at a PRTF. So we think that this is really, while it's obviously very hard and challenging right now, we think that this is really a moment that we can capitalize on a lot of the restorative practices and the trauma-informed care-based practices that we really want to see in our communities and with the young people that we're trying to advocate for, and the young people that are advocating for themselves.
Was that young man Cornelius Frederick, or is that somebody else? And I don't think most of our attendees know much about him, but they should. Could you share a
Yeah,
little more about his life?
yeah. So we've worked really closely with our Michigan member on this case. Cornelius Fredericks was a young man who, had ultimately become a ward of the state. He was in and out of different facilities, and unfortunately found himself at Lakeside Academy, which is a facility that's ultimately operated by a for-profit corporation called Sequel Youth and Family Services. This young man was gotten to some sort of an incident where he threw a sandwich and was restrained by the staff members at this facility, and he was restrained to the point where he stopped breathing and ultimately died. Unfortunately, we believe that there are a series of things that could have been done to, prevent this. But ultimately, we want to highlight the fact that, situations like that occur in facilities all the time, and maybe they don't rise to obviously the tragic death of a child, but ultimately, there are a lot of other egregious incidents that occur in these facilities, and we really want to shine light on that. So that's certainly been one of the pieces of work that our organization has been doing, and working very, very closely with members across the country to kind of figure out some solutions to really eliminating for-profit facilities, specifically PRTFs.
Hmm. So what about you? What motivated you to do this particular work?
Yeah, it's funny. I actually was back at my parents' house this past weekend, and as you get older, you have to go and clean out the things that have been stuck in your parents' house over the years. And I came across an article that I'd written
By the way,
back.
you don't seem that much older to me,
Well,
so
it's
it's
funny.
all relative.
I found an article that I had written back in high school that talked about racial disparities in school systems in my local county. So I've been doing this work for quite some time, and to talk a little bit more about the mental health aspects of the work that I've done in my past. I started out being introduced to mental health on a very personal level of having several family members with some mental health issues, and more specifically, I actually had to visit my sister in a facility when I was a young kid, and I remember visiting her. This was a behavioral health center in Greensboro, which is the city that I'm from. And it's everything is full circle because after passing the bar, after becoming a lawyer, and in my earliest years of practice, after a couple of years actually of practice, um, I began doing some civil and involuntary commitment work as a public defender, and specifically in juvenile court. So I did that work for adults and children, but I actually ended up in the same facility visiting clients at the same facility that my sister was actually in at a certain point in time in her life.
So why do you think it is that we've been so quick to move young people with mental health conditions into systems of care? And sometimes we use the term loosely, like this.
Yeah, I think that's a great question. Clearly, it really comes down to this. It comes down to resources. At the end of the day, our society has chosen to invest in, over policing our citizens, and of course, that also includes children and young people. Um, we would rather see, a movement towards putting resources in communities so that people don't have to interact with police, and that they don't have to, be handled by a system. Very often in my court experience, young people would come in and would be accused of minor things for the most part, that didn't really rise or need to be addressed in court, but it was one of the easiest ways to ensure that a kid that needed services or resources was given the opportunity to have those resources. And what that comes down to is the lack of those types of opportunities and services being in the community and being accessible for people in communities. So when we talk about the racial disparities, and we talk about the risk factors for developing a mental illness, we have to talk about poverty. We have to talk about the exposure to environmental toxins when people don't have clean water, right? We have to talk about the stress related to chronic discrimination in this country. And we also have to talk about the loss of close relationships and witnessing violence, and ultimately what that is trauma, right? So at the end of the day, there are a variety of factors that have led to kind of this critical mass of a crisis in mental health in this country. But we have to figure out a way to really think about strategically where we're putting resources and what we're doing in terms of how we're allowing people to access those resources.
I couldn't agree more. And obviously, that's a big part of the mission of Mental Health America, too. So many people try to reframe prevention, reframe early identification, reframe earlier interventions around taking people and moving them outside of the juvenile justice system and then later on the adult justice system, which seems to me to be awfully back-end oriented. It's awfully late in the game. And, you point out that, if we're looking at community level, we're looking at things like trauma, we're looking at things like, neighborhood violence, we're looking at things that we subject people to as a matter of policy. They're very different. And if we address those concerns, we wouldn't just be addressing these public safety concerns down the road and these mental health concerns. We'd actually be improving the overall health and well-being of the population, too.
That's right. That's absolutely right. I mean, when you talk about the numbers in terms of juvenile justice, I don't love to talk about numbers, but they're really important and they tell a story if used well. 70% of young people, who come into contact with the juvenile justice system have a diagnosable mental health disorder. It's not very different if you really, ever spent any time in a courthouse with adults and spent time in a jail, to know that some of those stats are very similar when it comes to adult folks. And if we as a society could choose to prioritize and value, mental health in this country, we could avoid a lot of the issues that we see in terms of crime. We criminalize poverty, right? We criminalize people not having places to go or places to sleep, when at the end of the day, people need resources. People need to be able to eat. They need their basic needs taken care of. And mental health is a part of that. Over 60% of young people, with a mental health disorder have a substance abuse disorder. So we're talking about addiction issues. We're talking about exposure to different things at very early ages that creates these dependencies on chemicals. So these are all factors that need to be considered and really need to be discussed, both at the community level and at the state level and at the federal level, to ensure that, again, we can bring those resources. And when I say resources, a big part of that is ultimately just dollars into the right hands, into the right communities to provide for services without having to require a kid to become involved in the juvenile justice system to make that happen.
Yeah, it seems like for the last 40 years, maybe, we're not supposed to talk about dollars. We're not supposed to talk about money. People can couch it, will couch it in terms of investments in our future, because the bottom line is, the minute somebody says you got to spend more to do this up front, then somebody else comes back and says, yes, but all those taxpayers are, aren't going to want to pay more, aren't going to want to pay more for this. I think that sometimes they miss the point that, we're paying the dollars and people know we're paying the dollars, and we're paying them in places we don't want to be spending them. And we're spending a lot of them in those places like jails and juvenile justice centers, juvenile detention centers, adult detention centers, even custodial care institutions. I think that, I sometimes, sit back and say, well, why? Why is this that we're not, putting a lot less in overall by putting a lot more in up front? But the reality is it does boil down to it being just that simple, that we can't be afraid to just ask for more money for this stuff, to ask for more money to improve the lot of people, everybody.
I think that's right. I think that, it always has to be money plus. Even in educational law and children's law, we find that it's not always just about the allocations of dollars, because sometimes just increasing money isn't enough. What we need is money plus the lens of racial equity and anti-racism. We need a lens that recognizes and acknowledges that we're dealing with systems that are intrinsically tied and connected to this country's issues with capitalism and slavery and racism. So if we don't have that analysis when we bring ourselves to this work, I think really, I think unfortunately we're going to miss the mark. You can flood the dollars in there, but you're not going to be putting them in the right places with the right level of analysis. So I think that it's really important that we really talk about the disparities that exist, the racial disparities, and the fact that so many Black children and children of color have to deal with so many additional burdens that really only contribute to mental health issues.
Yeah, I think you're so right about that. And if people think that we just throw more money into a system that is already segregated, or a system that already denies care to people, a system that is already, built on a racist principle, that we're not going to achieve the goal of social equity. We're not going to achieve the goal of making certain that everybody advances, and so, as some would say, all boats are lifted. And but again, that of course shouldn't be an excuse, and it's been made an excuse, I think, for people to say, well, then we shouldn't spend any money at all. First, we have to fix this, and then we can go about the business of spending money. I think it kind of needs to be in reverse. We need to literally invest money in anti-racist systems, and when it comes time to tear down some of those, that and I'm a big fan of moving money. When people say, you want money in the mental health system, where's it going to come from? You're asking for billions and billions of dollars. I'm a big fan of saying, look, take it from the jails and the prisons. I mean, I don't want that system, and I know that one's built, and stacked against certain people. So I do think we can hold both thoughts at the same time. Don't you think? I mean, we can get policymakers to understand that you've got to spend more, but you've also got to take it away from certain places that aren't doing anybody any good.
That's right. I think we can walk and chew gum. I'd like to think. At the end of the day, these systems build themselves, right? They have been built by people. They maintain themselves, and I think ultimately, when you create a system that relies on literally bodies in beds, in cells, it's dependent upon it keeping on going, right? So we need to incarcerate. We need to do that. But I think that if people reimagine what it looks like, and if we begin to shrink those criminal systems, and again, reallocate these funds, reallocate these resources into places where, maybe we don't need a 1,000-person jail because we created a facility or some sort of community-based program that allows for, the 30 people or 40 people that might have mental health issues, they have some sort of resources to address those issues. Unfortunately, I know that in certain times of the year, people will figure out a way to commit a crime to find a place to sleep, or have a hot meal. And we ultimately really need to be dealing with and addressing those things before just continuing to build up this system that really kind of just eats itself and eats off of other people.
I really appreciate that, and I think your perspective is right on. I think that I'm excited about the work that you're doing. You give me a lot of hope for the way we can move forward. I think you've got the perspective that I'm glad we're able to provide a platform for you to share. I think it's a far broader perspective than maybe people would have thought in looking at, oh, they're going to do a session right now about juvenile justice, and how narrowly focused is that going to be? So I just really want to thank you, basically, for the work that you're doing, and thank you for spending this time with us today. Do you have any final thoughts that you'd like to share about what it is? If there's something out there that I haven't asked you about, or something that we ought to be doing that we just haven't thought to do yet to work more collaboratively forward in the future?
Yeah, I think I'll leave folks with this. In the midst of this pandemic that we're dealing with and that we're facing in this country, the young people that are behind the walls of these facilities are really at even greater risk than they've ever been. They're subject to dealing with isolation and being, completely away from their families and removed from the ability to even, physically be in the same space with them. We also have to address and recognize that there is a huge technology gap that doesn't even allow for those families to necessarily always be able to virtually be in community with their children like we are right now. Service suspensions are across the country, happening as a result of this pandemic. Use of solitary confinement is also an issue that, we as advocates are concerned about, whether it's, medical isolation, or if it's solitary confinement as a result of kids having, to deal with the trauma and stress of being in these situations. And then obviously, there are limitations with staffing right now as a result of the pandemic, and just people trying to generally avoid that physical contact and proximity to other people. I think we really need to be thinking about ways to, make sure we're protecting our kids. But just to talk a little bit about what you said with the broadness of this conversation, juvenile justice is criminal justice, but it's also about our values as a society. If we aren't taking care of young people, if we aren't taking care of those that are most vulnerable, then we'll be worse off as a society, and we won't have anybody to take care of us when we're old and gray. So we really need to invest in young people. We need to invest in new systems and new opportunities that allow for young people to lead the way. My organization had a forum a few months ago, and we invited young people with expertise and experience in dealing with the mental health systems that they found themselves in. We gave them a platform to speak, and we want more of that. So if you all know of young people that are aware and working to do different things to change the systems that they find themselves in, please send them to National Juvenile Justice Network, and we'd love to work with them. So with that being said, I really appreciate your time and this opportunity, and keep up the good work.
Well, I think all of those points are important ones, and I'm really glad that you've made them. And we have a large young constituency. So many of the people who come to us for mental health services will overlap with the people that you're serving, because these are diseases of childhood. Half of mental illnesses emerging by the age of 14, 3/4 by the age of 25. So we do have youth groups. We have featured some young people at this particular conference, and as we have in our past few conferences too, and we'll continue to do that in the future. So I think this is going to be an avenue where we can work together, and it's so critically important, as you say, because we can't keep accepting the fact that at the back end, people are wondering about, how do we get 40-year-olds out of jail and out of the revolving door of homelessness and incarceration, when the answer is that we're the ones who started them there, back when they were 10 or 15 years old. And so the work you're doing matters, and it's making a difference. And we're looking forward to working hand in hand with you as we move forward. Thank you so much, Ricky, for joining us today. We'll be right back.